One of the things that is absolutely uppermost in people's minds, particularly staff who are responsible for assessment and the initial contact with social care services, is the changes to the eligibility criteria and regulations. This has been the subject of much work between ADAS, the Local Government Association and the Department of Health to try and get this right. The impetus is to make sure that people who are currently entitled to social care services, who meet the criteria for critical and substantial risks to their independence, do continue to receive a service. At the same time, we've worked hard together to try and make sure that the regulations reflect more personalised services which are trying to achieve people's outcomes. So we've tried to modernise the regulations to fit with a service that is fit for the 21st century. And clearly this is a balance in terms of trying to meet that objective within the available resources that we have at the current time. So I think for staff looking at training in this area, it will be important to think about how to apply those particular criteria, but in a way that is very much in partnership with service users. We want to make sure that any assessment is as far as possible co-produced with service users and carers. We want to make sure that it focuses on people's needs and their outcomes rather than a list of activities or indeed any notion of people's deficits or difficulties. So what we're trying to do is to create a system and an assessment process that is much more akin to a personalised approach to social care services and indeed extending this into health.